Hi, welcome to Healthcare in Context. My name is Charlotte Seyfried. I am a breast cancer survivor, a caregiver, and a patient advocate, and I'm the founder and creator of charlottepxp.com. And this is my partner.
Hi, I'm Caitlin Holcomb, founder of Wellness Communities. I'm a certified community health worker through Baylor Scott and White. And shortly after earning my MBA, I quit my job to start focusing full time on helping people to dwell in wellness. And welcome to our series, Healthcare in Context. We call it this because contextual care matters. In fact, evidence shows that paying attention to contextual care factors improves the likelihood of positive medical outcomes by 70%.
And we all know that our stories have power. So that's why we are here to collect them and share them with you. Join us as we learn from these stories.
We're here to, one, be that resource for patients in sharing these stories and the wisdom that comes with them. And two, we want to be a resource for providers out there who do deeply care about the patient experience and offer them actionable insights into how it could be improved. We want to clarify, neither one of us are doctors. Nothing that is discussed in these interviews should be construed as medical advice.
Hello, and welcome to our series, Healthcare in Context.
Because contextual care matters. But really, it does. Your outcomes improve by 70% if you pay attention. But what we are here for today is to hear the stories from Andrew, Ryan, and Christine. So whichever one of you would like to go first, I'd like to get started with a little bit of background and context. First question, what prompted you to get your cancer screening?
Ryan, would you like to go?
Absolutely. So what prompted me to get my screening is that I found a lump in my breast, and I thought that it was just a normal thing that happened along with my cycle, but it didn't go away, and ended up having some dimpling in my breast, and so went to my gynecologist for my regular exam, and also had her do a breast exam. She turned white as a sheet, ran out, and scheduled my diagnostic mammogram and ultrasound immediately. So,
Well, I'm glad that she moved that quickly.
me too.
But I'm sure that it was really scary at the time.
It was terrifying. And while she was very supportive, and I appreciated that she took me seriously, her panic made me panic a little bit more too.
Yeah.
Yeah.
That's super interesting because I had like the exact opposite experience.
Wow.
So I had a mammogram right after I turned 40, which was normal, but they told me that I had dense breast tissue. And I had asked, should I do anything follow up? And I was told no. So fast forward 10 months after I got the clear mammogram, I found I didn't have a lump, but I had dimpling and my breast was going concave. And so it was right before my annual visit with my gynecologist, and I brought it up to her then. And she was like, yeah, I don't really know what that is. I guess I'll send you for a diagnostic. And when I had called to set up a diagnostic mammogram, the earliest appointment was 4 weeks.
So, Christine, hold on. Because I think what you're saying is really key. Would you mind leaning in a little bit closer?
Sure.
And just to be sure that I'm hearing you right. So basically, while you were breastfeeding, you were told that your breast tissue was too dense to go get a mammogram?
After I was still breastfeeding, I still got a mammogram. But on my results, it said I had extremely dense breast tissue. And when I had asked the doctor about what do we do about that, because it stated there, that means there could be cancer and we don't see it. But I was told, I asked if I should get a follow-up ultrasound, and I was told no, not at that time. And then 10 months later, my breast was dimpling and going concave, and where I live, there are two big health systems, and I was playing phone with both of them of who could get me in for a diagnostic mammogram first. And because the earliest appointment was 4 weeks, and I had gone to I called my gynecologist. I was like, they want to get me in a month. I don't feel like that's okay. And she's like, oh,
Good
I
for
think
you.
it's fine. And I was like, but I don't. And so she tried to put it like high alert, or there's a better word for that. And when I called one of them, I said, well, this is like an emergency. And I was told anyone with a breast concern is an emergency. But then I was able to get in within 10 days of that appointment because I just kept calling.
Good for you. I'm so glad that you advocated for yourself. That's so important. And I'm so sorry that you had to do that and you weren't automatically triaged and placed in some sort of imaging that was easier to find.
Yes.
I had to do the same thing. Even though my doctor immediately called to get me scheduled, I was 4 weeks out. And
Wow.
he was so upset about it. And she and I both called to try to get me moved up, or at least to get on a waiting list in case there was a cancellation, because according to them, people cancel all the time. And when I called, it was so difficult to even like say those words and express the need. And what I was told was there was no waiting list. People canceled all the time. I could call every day until somebody canceled and they could get me fit in. And I sobbed on the phone to them that I was not capable of bringing myself to make that call day after day for weeks. And fortunately, my doctor was able to get through to them and bump me up, but it still was about, I would say, probably 2 weeks before I could get in.
I'm so sorry. And Andrew, I'd like to hear from you next. But before we do, I'm curious, Ryan and Christine, did anyone talk to either of y'all about driving to a different location that might have more availability or offer any sort of other alternatives that weren't a month out?
Yeah. So the two health systems that I live near, they have a lot of options, like they're massive. And I told them I would literally drive anywhere. So it was kind of luck on the draw. I had my child's pediatrician actually called to get me in sooner with one of the networks. And he was able to get me in, but I got in with one network. I don't know. On a Monday, I had an appointment on a Tuesday with the other network, but I was going to drive about an hour up to Orwicksburg. I don't even know where that is, but I was going to figure it out.
I'm so glad that you had the support of that pediatrician.
Yes.
Imaging is a big problem. And whenever I had switched hospital networks myself, one of the reasons that I decided to go with the one that I went with for surgery was because they told me, they said, look, did you know that you can take this prescription and you can go anywhere that offers imaging as long as they accept your insurance? So essentially, you can go anywhere you want to. It's just that neither of the health networks in our area told me that.
And I don't think I wasn't in that spot mentally to think about going outside this area. Huge health networks here. They're ginormous. So the fact that neither one could get me in, I didn't even think about driving. If I was willing to drive to Orwicksburg, I could have driven to like Philadelphia or New Jersey or somewhere else. But at that point, that wasn't going through my head.
I wasn't given any other options. There were a few places in or around Asheville that I could have called, but the wait was as long, if not longer.
How was your experience, Andrew?
Well, I guess similar to the way that Ryan initially kind of described hers, in that it all just happened sort of like in a matter of days. I had a lump in my testicle. It was pretty obvious. It was growing pretty fast. I had to check in with my GP, and yeah, he was quite concerned and sent me for an ultrasound that very day, and I was diagnosed like immediately. Yeah. Um, so, but I guess maybe I'm fortunate. I'm in Boston. Overall, very swift care.
I'm glad that you got the care that you needed so quickly. And that's the goal for all of us, certainly.
Andrew, so your results were, you said, basically delivered the same day?
Yeah, pretty much the same day. Yeah, it was pretty obvious what was going on, I think, to the GP, and yeah. So, and yeah, everything unfolded very quickly. They prioritized my surgery, the biopsy, and chemotherapy happened. I mean, as soon as I recovered from surgery.
That's amazing. I'm sorry you had to go through it, but I'm glad that they were able to do everything quickly and that you're here with us.
So each of you have already kind of shared some of the initial pain points that you encountered in terms of, it sounds like, longer wait times to try to get screening. Fortunately, that wasn't a universal issue. I'm curious, Andrew, I'd like to come to you first, and then we'll circle back, Ryan, Christine. But I'd like to hear, particularly in that screening diagnosis phase. I mean, of course, there's a litany of things that are probably just overwhelmingly going through your mind in that moment. In the process itself, were there any particular obstacles or challenges that you encountered in that screening and diagnosis part of the process?
I guess there was like initial uncertainty, right? Like they thought, well, maybe it's just stage one, right? And we'll see if surgery will be enough. And then it was pretty clear after surgery, right, with the biopsy that maybe it was stage two chemotherapy would be required. And then, I think by the time they started doing the CT scans, they realized that, gone to stage three. So, the news kept kind of getting worse. I don't know. During the diagnostic phase, I felt for me, but it wasn't, I don't know. I think it seemed like they were just doing their level best to get me whatever information they had at the time, and so there wasn't promises that it was one thing or another.
To be clear, it sounds like, it started out, and obviously, of course, your doctors were working with as much information as they could best gather. It sounds like kind of as you went down that road of first the ultrasound, then the surgery for the biopsy, and then the CT scans, and it was each of those different diagnostic stages where you kind of learned it was actually a later stage.
Right. Yes. Yeah. Yeah. But at the same time that they were also sort of like simultaneously prioritizing me more and more, right? It was like, well, we'll start chemotherapy in a few weeks. We'll get you scheduled. But then it was, oh no, it turns out your CT scan, indicates it's everywhere. Now we're going to have to get you in quick, so, and I think they adjusted the, number of cycles accordingly very quickly as well.
Did you have any issues with the scheduling? Were you able to clear your schedule that quickly?
Yeah. I mean, I was like, very generous kind of workplace, right? And one thing that really stood out to me is like the Mount Auburn Hospital. It's like a little teaching hospital, very intimate. So you get to know everybody very well. I was probably the youngest person there by many decades. And I was pretty doted on, I had like one nurse the whole time.
Wow.
And I could like actually convince them to open up like an hour early so I could do my treatment, like start at 7. And, I wanted to keep working just to, for my own, I don't know, mental health, I guess. Yeah. And they're very accommodating, very like a family. It was like a family, yeah. So I got to know a lot of them. We're Facebook friends, like.
Beautiful side of that provider-patient relationship.
Yeah.
I love that. Christine, what about you? Any particular obstacles or pain points that you encountered in that screening and diagnosis part?
There were several. So when I initially got in for my diagnostic mammogram and ultrasound, they had found a concerning spot and said, okay, we'll schedule you for a biopsy, but we can't schedule you for 4 weeks. And I was like, well, that's cute. I'm here, you're here. We're going to be doing this biopsy today. And the doctor said, we will not be doing the biopsy today. And I said, okay, I'm just going to sit outside and I'm going to have someone bring me lunch and dinner and food, and I'll just hang out. And when you have some time, you could just wheel me back to do a biopsy, but I'll just hang out here. It's fine. I have my book. And he kind of walked out of the place a little bit huffy, which I do understand. And I was there with the scheduler, and she's like, I'm trying to get you in. I'm trying to get you in. And then she left, and then the doctor came back in, and he said, well, I guess we'll be doing the biopsy in 15 minutes. So I was able to get the mammogram biopsy or ultrasound and biopsy all done in one day, which
Wow.
I had to be very lucky. But it was just because I advocated, and I was downright stubborn and a little bit rude, but I was standing up for myself. The other thing that happened, I had just switched jobs. So literally the day I got the call that I had cancer was my first day on my new job. And I had been at another job for 10 years. And this was day one, which means I no longer qualify for FMLA or any kind of federal protection, because even though I'm a teacher, so I went from one school district to another school district, essentially lateral job. I got to carry my sick days with me, but I didn't get to carry the ability to have FMLA and to have any coverage. So that whole idea that I don't have any protection, and the carrier of the insurance in my family, and that could be taken away from me at any moment during my cancer journey, really clouded a lot of my judgment and my ability to think clearly through things, because I was so worried about losing my job and my insurance. And what would we do then?
So stressful that happened at that time.
Yes.
And it's so amazing the way that you advocated for yourself. I think we could all learn a lesson about that. There's so many times that I should have stayed there and said, you can work me in. It's a sick appointment. You can work me in. But to have gone through it right after transitioning to a job, I can't imagine how stressful that was and how much it did impact all of your care decisions.
And I can only imagine, the average person spends around $150,000 out of their own pocket for cancer treatments. So I completely understand where you were coming from and going, I don't want to lose my insurance. I can't lose my insurance, and how that would have shaped so much of how you handled things.
Yes. I do. It was just so interesting, because where I work now, where I work for, my direct supervisor is an amazing human being. And she has done, and the core group of people I work with, amazing human beings. But go up to human resources, I actually got a letter as I was out. I'm probably jumping ahead, so I'm sorry. But I got a letter about my excessive absences after I had a mastectomy, was going through chemotherapy, and I had gone through all of my sick days. And so I was getting letters from HR and saying, we will be putting a letter in your file regarding your excessive absences this year, and please schedule appointments after school. So that the amount of anger, you're already angry when you have cancer, or at least I was. And so the amount of rage I had, and they know exactly where they stand with me, because I've always been kind of no nonsense. Cancer has made me more no nonsense. I don't know if that's good or bad for the world. But it was just, they knew me very well at the end of that. And that just made the cancer experience so much harder to work for people several levels above where I am, but who just were so not understanding, and they had no empathy.
Mm-hmm. Well, I hope that they'll change their standard way of responding based on their interactions with you.
I hope so too. That is one of my goals.
Well, and I'm curious with the initial screens, the ultrasound, the mammogram, the biopsies, the CT scan for you, Andrew, were you all offered? I'll ask Andrew first, and then you, Christine. Were y'all offered for the screenings and the diagnosis conversations? Was there ever an option or a need to do it outside of those normal business hours?
Not for me. I was already sort of like in control of my own schedule at work enough that definitely I managed to kind of like work through it, but like it kind of would have been an issue. Like I had just taken a new job as well. I was like a few months into it. Luckily I didn't, have to use like whatever limited FLMA that I had, right? Definitely now, like, just like listening to you, Christine and Ryan, like it wasn't always like, I would have to say, there's some pain points definitely when it came to scheduling tests and scans, because you're working with administrative staff and not necessarily like, your care team, right? And those are different people. And I don't know. Key for me was like, I had, my father lives close by and he just had retired at the time. He spent a lot of time helping me out, and being sort of like a second person at my appointments, right? But boy, I mean, just following through on all the administrative stuff would have been very difficult to do, I think, on my own. Especially you get like fuzzy kind of headed, after a while too. So that becomes an issue, and boy, I think like if I had to do it alone, I worry about people who, I don't know, maybe their English isn't as good, right? Or, they're elderly and I don't know. Yeah.
Or they don't have the support, of anyone. I remember consistently thinking, like, I don't know how people who are single moms, for instance, that don't have family, I don't think you'd even go in to get treated at all. I think you would just completely miss it.
Because we're like they wanted to like, okay, when are we going to schedule the next like round? And you have to get tests first, and then we're going to review the results, right? And the administrative staff wouldn't schedule the test in time, like it made no sense, right? And so of course you have to like call and be persistent, right? And luckily I had like an advocate to help me with that, right? Loose enough schedule I could, do it myself, but boy, and I'm a pretty persistent person too. So.
I imagine there's a point in the middle of it, or even there are points throughout, I imagine, where your energy, let alone chemo brain, those side effects, but just the sheer fatigue of it. If you don't have that advocate, I love that you had that supportive workplace. I love that you had that, your father right there.
Yeah.
I can imagine how hard that would be if that's absent.
Yeah, keeping track of like medications, boy. I mean, you need kind of a spreadsheet to do that. I don't know. I'm kind of a type A person, I don't know. Like I have, comfortable with a spreadsheet, you know what I mean? But like, boy, I miss things, if like you're not, yeah, you have to wonder. Yeah.
Christine, I'd love to hear. And then Ryan will come to you.
So the fortunate part is I am a teacher, and at the beginning of the school year, we have a lot of in-service days where like we work Tuesday, Wednesday, Thursday, but not Monday, Friday. So I was able to work with the scheduling department, and I laid it out. I was like, I just started a new job. I have no FMLA. I'm going to get fired and lose my health insurance. I need you to schedule things on these days. And the health team that I ended up with was very understanding and angry on my behalf. And so they did things for me to make sure we could get things done in a timely fashion. When I met with my breast surgeon, it was a day I took a half a sick day, and she's just like, I don't want you to have another half sick day to come back here. So we did all of the paperwork, the pre-surgical, we had the initial diagnosis appointment, and she said, let's just do everything now. And we got all the surgery stuff kind of out of the way. And when I had questions, we would just talk via the portal, or she would call me so I wouldn't have to have appointments.
I love that. Again, a great example of the beautiful potential that can and does often exist between provider and patient.
Yes. And my oncologist, throughout the whole thing, she does not take 4:00 patients. That is a thing. She has a rule. She made an exception. I was her 4:00 patient at any point I needed to see her. And she would accommodate me virtual. She didn't prefer that, but we would do that. So my health team was very supportive of my situation, and that made things a lot smoother. And I felt more kind of confident that I could get it done and maintain insurance and maintain some kind of semblance of a life. And that brought down my stress level.
I'm so glad.
That's really just beautiful. Thank you. Brian, with you, pain points, obstacles that you encountered in that screening and diagnosis process?
Well, I'll start by saying I am that single mom that doesn't have any family close by. I have amazing humans, family, I call them, that supported me through all of this. But, I was very much kind of breathing through and trying to process how I was going to be the mom and be the sole breadwinner for this household, and also navigate this cancer road and make it all work. So that in and of itself was a pain point. I think for me, the biggest thing was I felt a lot like it was just a lot of back and forth, the timing of things, and the beauty and the curse of the patient portal, right? So I got all of my results in my portal before I ever got the response from the doctor. So when I had my biopsy, that result came into my patient portal, and I read it before they picked up the phone and called me. Now, was I also stalking my patient portal? Of course I was. So that was a little bit on me, but for me, I needed to see it and have a moment before I had to talk to somebody about it. So that kind of worked in my favor. But when I had the mammogram and ultrasound, they will always say a biopsy is the only thing that can tell you that it's cancer. But the radiologist came into the room and said, a biopsy is the only thing that can tell you that this is cancer, but I'm going to go ahead and tell you that's probably what you're looking at. And then I had my biopsy, started all of the imaging. There was a lot of back and forth. I spoke with the surgical oncologist first, who kind of laid out a path for me of what to expect. Then when I met with the medical oncologist, she didn't necessarily agree with what that path looked like and ordered some additional imaging. So I had a breast MRI. On the breast MRI, there was something that lit up on the opposite side. So they did another biopsy, but we were still going forward with my port placement. I had my plans laid out I was doing chemo first, and then I was going to have surgery and then radiation. And when I went in for my port placement, the one time that I didn't get my result first, I found out 30 minutes before I was going to have my port placed that I was actually stage 4. And that got slipped out by the surgical oncologist when he came into the room to let me know that even though that was a distant met, because it was just the one spot and it hadn't been in bones or other organs, they still wanted to proceed with our path that we had already laid out. So it's a lot to process anyway. But when things just kept changing and shifting, as they have to, right? Because as more information becomes available, you have to adjust. But as the patient, that is the person that is getting jerked around, it was really difficult. Thankfully, I always had someone with me at my appointments. My friends set up a calendar, they signed up for appointments. Somebody was always with me to like be that second set of ears, to take the notes, to make sure that I wasn't making stuff up that I heard or mishear things, because you're just in a tunnel sometimes. And you could be trying your very best to pay attention and hear every word that's said, but it just goes past you. So those were my pain points, but also like my friends showed up for me in a way that I could have never asked them to do, but they did it without asking.
I'm so glad that you had that support. All of you who had a support person come with you, did they ever take notes or help you remember what happened in the appointments? Because I feel like you're in such a state of emotional shock. You go in there and they sort of like just throw information at you, and it feels like, you're just being buried underneath a tidal wave of information. And then you get out of there sometimes and you're like, I don't know what just happened. So did you have note taking, or did you take your own notes? How did you handle it?
Had a book that I was given by my network. They sent you after I was diagnosed, I got something in the mail, and it was like with the social worker's number, and they had stapled all these business cards in this notebook for me. So that became my notebook that I brought to appointments. Most of the time it was my husband who came to appointments. Sometimes he couldn't come and I would have someone else, and everyone just knew to look for the bright pink notebook. And that's where things were. And we just all logged it down. And everyone knew to refer to it when I was going through chemo, when we had to call a doctor. Everything was just in that book. So that became like critical for me.
Wow. That's amazing. As someone with ADHD, whenever I went in, I just tried. Like I would bring a sheet of paper and I would write it down, and then I would go home and promptly forget where it was. So it wasn't that helpful. What about you, Ryan? How'd you do it?
I also had a notebook. I wrote down all of my questions as throughout the week, or like in between appointments. If something came up, I would jot it down on that notebook. And then my support person, whomever that was responsible for making sure I asked all of those questions, and they took down the answers. Depending upon who was there, because I had a few people that were not necessarily comfortable with writing, didn't feel like they could write quick enough. And so as long as my doctor was okay, we recorded it so that I had like a voice memo I could go back and re-listen to. And everybody was amenable to that except for my surgical oncologist. But it was fine.
I did that with my mom too. I would record the sessions because I was also emotionally compromised, and I didn't know if I would get everything, and I didn't want to miss anything. So those are all really amazing tips. What about you, Andrew?
I know you mentioned your spreadsheet.
Oh yeah, so that was for like sort of to track all the medicine. I would take notes, and when I wasn't feeling up to it, my father, who was my support person, would, and we'd always sort of discuss it in detail afterwards to make sure that we had sort of heard the same thing. So that was pretty important, because I think we would have missed something if we hadn't been so diligent. Really critical to have that support person. That just made all the difference.
I used to always ask the doctor if they were going to send me all the notes of the things that we discussed. And I think they would always say yes. And then I think I got it maybe once ever, like the summary.
That's so Charlotte, and I love that.
Thank you for listening. Context is everything in healthcare and life. If you believe in what we're doing and want to support us, please remember to like, subscribe, and share our channel. Reach out to us if you want to be on the show, or you think we should cover a different topic. What did you learn from the show today? We want to hear from you. Please comment or contact us through dwellnesscommunities.com page. And don't forget to check out our curated list of products while you're there. It's in the shop tab of the dwellnesscommunities.com page. It contains products that are tested and recommended by the people on our show, including me. We'll take a portion of any proceeds and donate it to Undo Medical Debt. For every dollar donated, it pays off $100 of debt. It also helps us continue to share these stories with you. See you next time. Until then, we wish you wellness. And if you aren't feeling well, remember that there are people working hard out there to make you feel better. See you soon. Until then, stay cozy.